Hey everybody, thanks for joining us on the House Call with Dr. Brian McHugh. I'm here today with Dr. Betsy Grunch, who was nice enough to visit us in New York with her family at the holiday season. She's a neurosurgeon down in Georgia, and I thought it would be great to get together with her, figure out a little bit about her journey and what gets her moving during the day. Dr. Grunch, thanks for joining us.
Thanks for having me.
So you're a neurosurgeon. You also have a family. What got you interested in it? How did you decide you wanted to kind of bite off that challenge?
So for me, I had a childhood experience that kind of led me to medicine. So I think most of us, right? I think everybody in medicine always has their story as to why they became interested in it. And in my case, I was 13 years old, and my mom was in a car accident, and she was paralyzed from the neck down from a C4 spinal cord injury. She was a police officer. So actually, before this happened to her, I really wanted to be a police officer. And her whole rehab experience, surgery experience with her surgeons and team really led me to become very interested in spine and spinal cord injury.
Wow.
So I started shadowing her neurosurgeon when I was in high school.
Wow.
And here we are.
That's so odd. Yeah, I guess that is a common... So I had... I don't know, maybe 10 or 11, I had osteomyelitis in my ankle. I had gotten kicked in a hockey game with a blade, and it had cut the ankle.
Wow.
And it seated the bone. But in retrospect, they didn't really know what it was. I just had this persistently sore ankle, and then all the white counts and all the markers were up, so they thought it was a blood cancer. So I was hospitalized for 2 weeks.
Wow.
But I had fun. I have this strange memory of watching the Rambo movies as a 10-year-old in the little entertainment space, and just the nurses and the buzz of the place and how people cared for you and were looking after you had this strange impact where I was I think I want to do this. And obviously I was super young, so I can't put that out of my mind for a long time. And then came back to it. I don't know if you had this experience, going through, obviously medical school is intense, the whole training is intense, and people have to kind of decide.
Little bit.
Yeah, a little bit. Decide they want to get into that. And then when the decision to become a neurosurgeon comes up, I get a lot of pushback from peers, friends, who would say, oh, you don't want to do this. It's such a commitment. It's so long. It's so grueling. Almost trying to talk me out of that much of putting that much of yourself into it. Did you hear that at all? Was that?
Oh, absolutely.
Yeah, right.
Yeah. I mean, being a woman as well,
I'm sure you got extra people.
Absolutely. Yeah. I would always, I think the accident happened when my mom was 13, but I really became very interested when I was 15, 16. And that's when I started kind of shadowing her surgeon. And I didn't really say that I wanted to become a neurosurgeon until I was probably 17, 18, starting college. And then, and anybody I would talk to or shadow, had even one of the surgeons that I work with now was you really want to do this? You don't want to do this.
Yeah. You
can't have a family.
Right.
So I just was hard-headed and persevered.
Persevered.
Kind of that, almost it's like a challenge to me. I'm very competitive. So the more people had told me no, the more I wanted to do it.
Yes.
Yeah.
Yeah, I think there is also I think you have to know yourself too. And those, at least in my world, the friends were kind of saying, you're a social person, you like to be out and around, and you have a social life. I think a lot of people that end up going into really intense endeavors, they're more committed and maybe sacrifice those things. And what I realized about myself was I still had that, I like to have a social life, but I also needed something that, there is that intensity there. And if I didn't fill that with something like a challenge, I'd probably find other ways to do it, right? I think if I took a path where there was more time available to me, either that would be idle time and the devil's hands would find his way in there, or I feel like I would probably take up, skydiving or something like that.
Right.
Do you feel like, is there do you feel like people who go into the field have like a adrenaline junkie element to it, or is it more just climbing that mountain, kind of like pushing yourself?
I think is a little bit of both. I mean,
yeah.
I definitely think that nobody goes into a trauma specialty like neurosurgery or trauma surgery without being an adrenaline junkie. I just don't think you would survive that rush of urgency and emergency that comes in our field. It is really very powerful.
Yeah.
And but yeah, I mean, I think that people in our field either are 100% in it, like work 24/7 nonstop, or they work a lot and then also have a very intense like outside
Yeah. It's sort
hobby
of like
or something.
work hard, play hard philosophy.
Right.
Anything. This has been like a little bit of a journey for me, trying to figure out how to, you have a family, I have a family, I have 3 kids. Balancing that is obviously an ongoing challenge, but came to me like where I was at the end of training, and that transition from trainee to actual attending is a really difficult one, and learning how to balance the stress, frankly, and still be able to be present for the family was like a real, I think I'm still learning that lesson.
Absolutely.
I sort of went the mindfulness route, tried to like meditate a little bit, little techniques like that. Anything like you can reflect on where basically like how do you juggle all that and stay sound? Like what are your tips?
Right.
Pearls?
I mean, I feel like having kids is survival of the fittest for anybody, if you're in neurosurgery or not. But no, I mean, for me, obviously, having to go through the pregnancy and bearing and starting a family was something that I knew I wanted, but the timing is just, I think for anybody in medicine, it's hard because our training is right in the middle of our 20s and early 30s, which is the prime childbearing years. And so for me, I met my husband in the middle of residency, and we got married when I was a junior, or like my 5th year of residency.
Yeah, the same thing.
So yeah, so we knew we wanted to have a family, but the timing was something we weren't sure about. So I waited until we were out of residency. And then, like you said, then you start your practice, you're growing your practice, you have to be kind of all in there. So we started 2 years into whenever I became an attending or in my own practice, when I felt like I was somewhat established, not established, but yeah, I was a little scared. I mean, I didn't know how it was going to affect my practice. What were people going to say? Like, what were my partners going to think? What my patients think? But I mean, I don't know why I worried about it so much, because everybody was just so great. All my, fellow colleagues helped support me, and patients obviously so supportive. And yeah, it was a journey, but I think being pregnant and operating is a whole nother
Oh my gosh.
whole nother league. But yeah, I mean, to your point about having the family and balancing family and work-life balance, I think that anybody in any profession strives to do that, and we all, particularly in a field like this, I mean, it's hard. I mean, I feel like there's some days where I'm 100% committed to being a surgeon, and I feel like I feel pulled from the other way, and then vice versa, and like I'm not giving enough to my patients if I'm doing something with my family. And so I think struggling to find that balance is always there. But once you do it for a little bit, you become better at it, and the mental struggles that come with it.
Yeah, I feel like that's probably part of the maturation process too. I mean, obviously not, stress isn't particular to medicine or neurosurgery, and I think, at least for me, part of growing still is not compartmentalizing, but doing what we do has a very high stress level, and you got to manage that, obviously, or that can consume you. And then adding the family elements in the background, which have their own stresses, and you're operating and something's happening on the home front, or vice versa. You're dealing with something at home, and then you get the phone call from the hospital, and trying to find equanimity in that space is, very overwhelming early on. And I think if I compare myself now, like roughly 10 years into practice from the beginning, I think I've gotten better at kind of staying even keeled in the face of, multiple incoming landmines. But that was like a challenge unexpected, frankly. Like early, it's all you in the beginning. Medical school's tough. The commitment's tough. Managing a social life while you're working like that's hard. And then you add the other people depending on you, and that just ratchets up that strain. And that I also saw that in mentors, right? Like as I came through, there were a lot of folks who I think in retrospect had probably just been chewed up by the profession, by the stress, right? There are a lot of these ruined families and people who had made some bad choices personally, and I think that was probably stress, like manifesting in that way. So I kind of, and obviously it's an ongoing challenge, but it just became very clear that was something I needed to get a handle on and be able to deal with in a real way. Probably right around when family came on board, because that just ratchets it to the next level, and you're like, right. Okay, I think I had the neurosurgery stress under control. Maybe my wife would disagree, and then you add the other level. It's like, okay, I got to figure this out, or it's definitely going to consume you.
Yeah.
And it's I don't know. For me, it's little tricks, like we try and take time out for. We just went over the summer and visited one of my wife's colleagues who is an attorney, and he runs a pretty busy practice. And he goes every Friday and gets a massage, and we went with him. And we were like, well, we don't want to interrupt your, special time. He's like, no, come with me. And after it was all done, I was like, I think we need to do this. Like, I think Friday afternoons is Massage Friday. Like, awesome, whatever we could make that work. Yeah. Little things like that to carve time out are.
And it has to be intentional, or else it's going to consume you. Yeah, and that's a struggle I find is trying to make that intentional. So I've made a commitment for this year. For example, like my husband will remind me of how much I work, and so I decided, okay, the 5th Monday of the month, I'm going to take a day off so I can go to my dentist. Nice. I can get my hair done. But the 5th Monday of the month, it's only like 4 Mondays a year.
Yes. No. Sorry.
So yeah, but I think it has to be to save your sanity, right? So I think it's important to take that self-care time, which we often don't. We feel guilty about, and I don't know why we feel so guilty about.
That's interesting. Yeah, guilt's a big part of that. It's very weird. I don't know what that is. I don't know. I always thought, I grew up in Massachusetts. I'm sort of Irish by background. It's an Irish Catholic family. New England has these like puritanical cultural elements. The Catholic Church has a lot of like guilt built into it. And I was always kind of thinking that's where it came from. But you see that in a lot of kind of workaholics, a negative term, but a lot of people that work a lot, there's just this like guilty feeling if you're not doing something work related, which is odd because you do so much. Like, why are you guilty about one Monday? That's bizarre, right? Like,
hasn't even started yet, and I'm already feeling guilty about it. But I think it's a culture of medicine too, and we're forced in our training, which is extremely toxic, to work. And I don't know when you went through your residency, but I did part of my residency before the 80-hour work week, and that was normal. Working 120, 130 hours a week as an intern was expected. That was the normal. If you complained about it or you talked about it, you would be, somewhat the black sheep, so to speak. And then, added on for me personally, being like one of the only women there who absolutely cannot complain. You did not, or you were already kind of the outsider. And so if you were seen as that one, then that was even worse. So I think we were ingrained in our culture that we have to work, and then patients expect that out of you. Like as a patient, you expect your doctor to be there at 2 a.m. If you got a little twinge of pain, I'm gonna call the doctor and get an answer. And so we expect to provide that, and then you do that for years and years and years, and it's a lot.
So it almost like institutionalizes the mind or something.
It does.
Yeah. Yeah, when you went through the training process, you were probably, not to like devalue women that came before you. I mean, I know that you can go all the way back to like the 30s and 40s, but still at that early 2000s era, you were probably one of the few female neurosurgery residents. I mean, is that fair to say at the time?
I think at the time, um, it was me and one other
Really?
female at
Holy cow.
Duke. And then my chief resident who graduated before me was a woman, but there was a few women that came before us, but not a lot.
Yeah.
And, I feel like it puts a lot on you because you don't want to devalue or give a bad reputation, so to speak, of women in the field, which it's easy to do. Like I heard somebody talk the other day about I can't remember what specialty it was, but they were like, oh yeah, we had a female resident. We're just not going to take those anymore.
Oh,
and
wow.
it's like, okay, but that one person just made such a bad kind of vibe into that became the face of any person like her. And so,
Mislabeled.
yeah, I mean, I think that's easy to stereotype, but anyway, it just puts a lot on you in training and, added.
You went in neurosurgery, for anybody listening that doesn't know, there's not always, and we all practice like a mix of both, but a big division is spine surgeons versus more kind of cranial or brain surgery focused people, practitioners. I'm a spine surgeon, you're a spine surgeon. I think we both do pretty complex work from reading your background, which are usually long, grueling kind of cases, and there's a lot of, I don't know, I like to call it blue collar neurosurgery. It's like there's drills and chisels and hammers and bending titanium rods and things like that.
Yes.
Did you, like, of the women in the field, how many of them choose spine? Is that common or
no?
Yeah, okay.
2%.
Really? Okay.
2%. Yeah. So I mean, and the majority of women in neurosurgery go into pediatrics, and
interesting.
And I think part of it is kind of almost expected. Like all the women that I trained with all went into pediatrics, and to be in spine, like you said, I mean, you have to be. It's like orthopedics. I mean, it's a very physically demanding specialty, and there are ways of getting around that. Some of the physical demands, but the bottom line is spine surgery is very physically demanding and grueling on your body, and you have to be pretty strong to do it, I think. So
one of our first podcasts was with this gentleman, Kelly Starrett, who's he was involved with the CrossFit movement when it first started, and then he had a YouTube channel called Mobility WOD, and he was really kind of a pioneer physical therapist in the mobility movement, and that's what he still does. And we were talking to him about a book, and so we got to talking to the OR, and he's like, what do you do? Like, how do you, what do you do movement wise? And I was like, it's, I guess, weird talking to you because I actually do a lot of weird stuff in there. Like I stretch, I do all these weird things. Everyone in the operating room is kind of like, what is this person doing? But as a result of kind of working with people whose backs and necks break down, and then also being someone who stands for 12 hours, you're just almost forced to see the cost of, not paying attention to your body. So I started taking basically like preventative measures. Talking to him was super insightful because he's like, they just have a whole language around it. And he brought up a few interesting points. I'll stop and do stretches. He was like, why not, put food outside of the operating room? Why not try and make sure you have a certain hydration goal throughout the day? Why not make ergonomic changes to your OR setup where you can, put a foot up and release some lumbar strain? And I thought that was really interesting. Do you do anything, or do you just kind of push through and make it work?
Well, initially, yeah. I mean, you just push through and
initially
do
for
it.
Sure,
Yeah. And then you kind of learn. But yeah, you're exactly correct. Like as I came into practice, I mean, I was unfit. I've always kind of been athletic and worked out, but yeah, you see what happens. Like you see patients come in 65 years old that have been obese their whole life and overweight, physically demanding jobs, and their spines are trash. And you're like, then you learn how these things happen, and so
Right.
you're like, how can I prevent this for myself? And so
How do I
because we're leaning over and like we're creating neck strain all day, lower back strain, and so yeah, you're correct. I mean, I think we all internalize our ergonomics and how we can make it better, and there are definitely techniques that I've learned in terms of different procedures that I've altered a little bit just for my own ergonomics. And funny enough, I was 2 years ago, about a year and a half ago, I was doing a lateral fusion and herniated a cervical disc, my disc during the procedure. And yeah, I mean, now thinking about what I was doing and how I was manipulating my body, I mean, it makes total sense. But yeah, I do stretches. I wear compression socks. I try to work out in the morning to get my body warmed up, stretching, and all those things are really important.
Yeah, the neck's a big deal. I can remember several like mentors there was an ENT surgeon when I was a medical student, and he had published a bunch of papers because he had to have his neck reconstructed from the ergonomics of doing head and neck procedures all day. And he shifted over to using the intraoperative microscope and kind of trying to stand, more upright and published on ergonomics. Like this was, 15 years ago at this point. And it's all over your head. As a student, I was like, well, what's he talking about? Now, as I'm doing, I'm like, oh, right. Maybe I can try and avoid the neck surgery if I think about it in advance. Maybe not. Who knows? But you have to take your body into account, especially if you want to do it for a long time. Otherwise, your career is going to get cut short. Although I'm hopeful we can practice till our 80s because there'll be robots that I can.
That's right.
Mobilize from an app. Maybe it'll be the last work from home job I'll be.
It's fascinating. I mean, like endoscopy, AI stuff, and robotic neurosurgery. All these new advancements. Exoscopes. All are more ergonomic than what we're used to. Loops and leaning down in patients all day.
Hunched over. Yep, not good.
Yeah. And it's better for the patient, too. So.
Yeah, that's true. Yeah, the technology will go make a big difference. I mean, the field's come a long way spine surgery-wise in, 20 years. If not to get too technical, but, these pedicle screws that we use on a regular basis now, if you're fusing someone's back or fixating someone's back, those were controversial in the late 90s, early 2000s. And before that, it was kind of like a chicken wire and hooks that they used, which were incredibly unstable. So the whole thing's like constantly moving forward, which is what makes it fascinating for sure. You've always been in Georgia. You practiced in Georgia for the past
10 years.
10 years?
Yeah.
Anything, you traveled outside the state for some of the training. You've obviously traveled as part of social efforts. Do anything particular about practicing in Georgia that stands out in your mind, like patient-wise, population-wise, the way people view healthcare there? Anything particular about it? Like, we're in New York now. That's where I practice. I had practiced in Virginia. I think there's some differences as you move around the country in terms of how people view their doctor.
Yeah.
How the market's structured from a healthcare standpoint, how they find you.
Right.
Any comments you can think of?
Yeah, absolutely. I mean, I think everybody has their own kind of market and patient population. For me, I'm in kind of the north corner of Metro Atlanta. I hate to even call it Metro. We're right outside of Atlanta, and we still get a fair amount. Our capture market is tremendous because we have the whole northeast part of the state, even into North Carolina, Tennessee, which is a lot of mountain folk, we call them, but patients that are more not they're more labor workers and just people that are I would say they just trust their doctor. I mean, anything I tell them, if I know if a patient's address comes from X area, they're going to listen and believe anything I say. And then if I have someone that comes from more of the city, I mean, they're more apt to have a ton of questions, be thoroughly researched on the topic, have had several opinions. And I'm just kind of in that unique area where I have all patients of all kind of backgrounds that come and see me. And it's fascinating to see that market. And I'm also lucky because that area is so large, and we're the only neurosurgeons in instances over like 120 miles.
Oh wow, okay, so you have that.
So like here, you probably have like 10 and like 3 miles.
Yeah,
right?
yeah. But you still, it's funny because you still see the same phenomenon. Like Long Island's a little bit divided, where more of the, I don't know if you want to call it like city migrator type folks are along the north part of the island, and they're more of a blue collar kind of culture in the center and south shore of the island. We'll see both populations, and I would kind of concur with what you just said, although it kind of goes both ways, right? Like you can swing down to those folks who will just trust blindly in what their physician says, and you can go too far that way, and it's like you probably shouldn't trust people that much. You get like a second opinion. And then on the flip side, the like hyper anxious educated person who's almost become their own doctor and can sometimes be telling you what they want, that can go too far, because it's like, I think you went down the rabbit hole and you're making decisions that you probably ought to leave to folks who do it all day, every day. It's good to be informed, but you may have kind of taken the reins too much. But it is interesting as a practitioner to kind of to go back and forth between the different types of patients. I think that's one of the things that makes the job really interesting. Like you're talking to and dealing with people all day, and if you don't like that, or if you don't find engagement and fulfillment in that, I would imagine the career probably feels empty.
Yeah,
I would think.
I think it's hard. I mean, we as surgeons, I think we're stereotyped into being that cold, kind of distant personality.
Right.
But you're right. I mean, I find enjoyment out of talking to people, working through their problems, getting to know them. What's their social situation? Like, are they going to tolerate this type of procedure that I'm recommending? And I think that surgeons who can really, that are more, I hate to say personable, but, people that can really try to understand folks and their background are going to ultimately be better decision makers than the surgeons that don't really want to talk, because it's so much of importance in their outcomes as to knowing what they're getting themselves into.
I totally agree with that. That's an interesting point, because especially I think in spine, like if you have, let's say, a brain tumor and it's aggressive, there's really not a lot to talk about unless you are at the end of life or something. In the spine world, if you have a really beat up back and you can't function, that's an elective decision, and it's maybe one of the lessons or ways I've gotten better over the years is it really is more about what's your social kind of setup.
Right.
Who are you as a person? Is this really the right thing for you? Can you handle it? Are you motivated to kind of recover from it?
Right.
Are you going to see value in it? And that's hard to communicate in the 30 minutes you have with the patient. You're kind of making judgments. It can be less.
I mean, it's, you have patients that come in, to your point. I mean, if you treat the x-ray, that's how back surgery gets, I feel like how back surgery gets a bad rap, because you do a certain procedure on the wrong patient. It could be the same identical x-rays and have two markedly different outcomes.
Absolutely. And we take heat for that. We take heat for that from payers, from the system, and I'm sure you're aware, there have been major movements by folks with major insurance plans who say, we're not going to cover this because of these mixed outcomes. And it's like, well, wait a minute, that's a life-altering procedure for many people.
Exactly. I think procedures are recommended, and it really it's choosing the right procedure for the right patient.
Yeah.
So like SI joint fusion is something I see that for past couple of years. I don't know if you do SI work, but
a little bit.
It's it's a great procedure, but the key predictor of outcome is going to be that decision making going into it, because it's so much of spine is decision making, and that's why you have a mixed bag, I think.
It's kind of why I like it, frankly. I mean, when I was looking at other options that, and I'll pick on colleagues,
you can. We're in a safe space.
Let's pick on the knee people. Tara's in the room. She works with a knee doc. It's very algorithmic, right? I mean, it's almost, that's where AI and these technologies can kind of come up with predictive analytics and say, okay, you're the right patient for a knee replacement, you're not, based on, radiographic kind of parameters. Spine's still in this world where there's very much an art to it, and it's a lot of social elements that go into it. And I think that the fun part is you can get good at it. As a practitioner, there's a real way to differentiate yourself that may not be there in a field that's a little bit more black and white.
Mm-hmm.
So,
I agree.
You have gotten into, obviously we're doing a podcast, so you've gotten into some social media. So have we.
A little bit.
We like it. For anyone who doesn't know, who's in our audience, Dr. Grunch has millions of followers on her social media. What's your handle?
Ladies Fine Doc.
Ladies Fine Doc. So, how'd you make the decision to do that? I mean, we're doing it for outreach, passion project. It's been really interesting getting to talk to people like you, all different types of folks that in a day's work, you're just not having those conversations. So
right.
we kind of did it as an interest project. When you were in practice and said, hey, let's try this out. How'd that come about?
Yeah, it was quite just the, I don't know, just all the moving parts came into play, but I've always been very much into like social media, Facebook, Instagram, just personally. It's a way for me to share. When I was in North Carolina, like, sharing my life with my parents, my family back home, so they could see what I'm doing. And so I've always been an avid poster, but when I started my practice, I started a social media company. It's weird as a physician. There's this, you have to be very careful about what you post, and it's easy to not do something correctly or to be seen a certain way. And so I didn't really know what to do with that. So I dwindled in it for a little bit, and then the pandemic happened, and I had way too much time on my hands. And
Don't know what you're talking
about. So my PA and I did a couple of Instagram reels, and my husband, I did not download TikTok. I was avidly against it, and he scrolled all day. And so one day I was like, all right, I'm going to download it, because I think so I read that the platform is a little easier to make videos, and then I could transfer them to Instagram. So anyway, I made a TikTok thing, put it up on TikTok, and posted it to Instagram. That was my intent, but it went viral on TikTok. And
oh, geez.
And the way the algorithm works is much different. I think it's changed since then, but so I was fascinated. I was like, wow, I'm reaching so many people. And it was about, that reel was, or TikTok was about being a female neurosurgeon. And it just had so much, of course, negative stuff, but there was a bunch of just people like, wow, that's, just positive comments and asking questions. And I became very intrigued about like wanting to kind of put myself out there, to give that to people like myself. I mean, because when I was growing up, I didn't have anybody to look at. So I just decided, I was like, all right, I'm going to post every day for 3 months, and I'm just going to see where it goes. And that was my goal. And then 3 months, and this was just on TikTok, I gained like 100,000 followers, which was a lot to me at the time. And I just felt it filled a fulfillment for me, like you said, like a passion project. I like to interact and talk and educate and be funny, and it filled a spot for me that was really very satisfying. And then it's kind of grown since then, and it's just been a fun thing. It's a passion project, but it's also become more of a little bit of a completely second job. But it's been a lot of fun, and it's got me here, and it's fun to interact with people, and
that's fun. Yeah. It's like gets you out of routine, but I think it also, like you were touching on this. I mean, you're probably putting yourself out there in a real way, and that's like a role model standpoint in some capacity to people. I think it humanizes the profession a little bit. It's like nice to. You're scary, right? It's like if I had to come see, even as a doc, if I had to come see you, I'm like, I'm scared because I have to go see Dr. Grunch and maybe get surgery. That doesn't make me feel good. And then in the old world, there really wasn't much out there. I'm probably not even going to see a picture of the person before I meet him. And I think it's neat because it's a way to humanize it, make you realize that everybody's it should be a normal person, at least who you want to go see.
Right.
And then get in front of more people and kind of bring exposure to the field, like, humanizes the whole process too. Like, I had no access to that as a kid. I didn't really know what it meant. And I know some people are really find a career or calling, and they research it from the age they're 7, and they know everything about. That wasn't me, so it was a big investigation. And obviously, the internet helps with that, but kind of being able to see people who are real to you and you can relate to in some way, who've gone through it, it kind of makes it seem more approachable.
Yeah, accessible.
Accessible, maybe. Yeah.
And approachable. I mean, you're right. I feel like, being, we didn't even have internet whenever I was in high school. Like the dial-up was like my senior year, but I mean, I feel that healthcare, our field particularly, is so underserved, and certain people, there is a certain stereotype of a neurosurgeon for a reason, because those are the type of people that were drawn to the field back in the day. And there were people like me, for example, that didn't feel that they could have that opportunity and didn't seek out because of that. And so one of my kind of passions is telling these young people out there, like, you don't have to be like white collar and a line of doctors to go to medical school. I was a mom of a police officer. My mom was single and made no money, and I took out loans and did it all on my own. You can do it too, or you can be a woman and want to have a life and kids and still do this. And there's so many different ways of looking at it, but it makes it healthcare more accessible to the young minds, I think, and you can be normal and still be a physician, or you can still have fun. And so that's one of the angles of looking at it, and from an inspirational standpoint. But to your point, like of patient access, I have patients that come to me with an unfound trust in me because they followed me. They know me. They trust what I say without even meeting me, and that's cool. But it's also a little, it's I feel like unearned trust.
Unearned trust. Do you guys find, like, when you, and I'm a novice at this, but obviously social media is like not necessarily local at all, right? I mean, people who could be following you could be across the globe.
Oh yeah.
Does what you're doing on social impact the practice, or do you find it's pretty much separate? Like it's kind of two separate pursuits essentially.
I think it's a little intertwined. I mean, I've had patients come to me from, many patients have come to me to have surgery from out of state. I think it's hard because, like we touched on earlier, spine surgery, a lot of it is the rehab and all that stuff. And so I feel like someone that comes to me from so far away and does a rehab so far away, I maybe I'm not giving them what I need to give them. So I do kind of sometimes draw the line on that. So it's hard, but yeah, I mean, I do think it's helped me grow my practice. That wasn't the intent of it, but it has made me much more busy, which sometimes
for better or worse.
Right.
Yeah. That destination healthcare, it's tricky. I mean, I think patients can seek that out sometimes, and it's not necessarily bad. It's just, a woman comes to mind who, when I was in practice in Washington D.C., who had sought out, she had a bad brain tumor and had sought out a surgeon across the country in California, had flown, gotten the surgery, but then developed a spinal fluid leak from the incision, and now she's home in Virginia, and patients may not realize this, but there weren't a whole line of neurosurgeons lining up to kind of take on complications from a surgery they didn't do. So she, in a way, was kind of up the creek without a paddle. Obviously, people are obligated to care for that through an emergency setting, and she was able to find care, but there's a little bit of it's a gray area for sure, I think.
Yeah, especially in our field. I mean, complications happen, and the person that does the primary work is going to be the best person to know what to do going back in. And I think it's hard. So there's definitely a line that I have to kind of navigate sometimes. But.
Yeah, totally. Do you, like, where do you see, I think we're probably both kind of similar in our careers. We've been practicing for, several years. And we have young kids. How do you see, like, the next 5-10 years? Like, I feel like we're all very goal oriented, and I had a big issue when I finally finish training, like that's a big mountain to climb, right?
Yeah.
And to some degree, that graduation ceremony is a culmination of, 15 years of effort, right? So it's like there was a transition there psychologically to say, all right, what's like the next kind of mountain to climb? To some degree, that's handed to you because you have to get into practice, start a practice. It is a transition to be able to function independently, not have a teacher looking over your shoulder anymore. So that kind of handled that. But moving forward, how do you think you'll continue to challenge yourself like you have in the past? Do you are you telling yourself, now I'm going to calm down and it's going to be relaxing? How do you?
I don't know what that is.
Yeah. Do you think in 5-year increments, or do you not at this stage?
I don't. I think in like 1-year increments.
Yeah.
And I never ever would have imagined 5 years ago that I would be where I'm at now.
That's
and
fair.
I don't know. I don't even know where to think 5 years would bring me. And I think that's the way we think, but then we find these goals and passions and that kind of divert. Yeah. And then it diverts our. So yeah, I don't know where I'll be in 5 years. I know I'll still be doing neurosurgery, but
very fair. Very fair. Yeah. I think you're almost programmed to a degree. I almost had to deprogram myself where so much time's committed to that training process, and it is very much laid out, and you can project forward. If you're committed to the process, you project forward depending on where you are, 3 years, 5 years. If you're at the beginning, you can project out the next 10 years of your life.
Right.
And then once that ends, you're sort of now back into a situation that the rest of the world's always been in, right? I'm not really sure what next year is going to bring. And that's an adjustment because you almost had like a blueprint for where you'd be, what you'd be doing. So to kind of go back to anything's possible is refreshing in a way,
right?
But can also be scary because there's so many possibilities.
Yeah.
Yeah.
I mean, and obviously, I know the next 5 years I'm going to be raising kids, and I can project on that mindset.
Yeah.
But everything else is a wild card.
Up in the air.
Yeah.
Nice. Well, thanks so much for your time. Dr. Grunch, really appreciate you making the trip up here.
Thanks for having me.
Hope you enjoy the city.
Oh, we're excited.
Get some shows,
get some Christmas lights,
some trees,
rockets, and all the Christmas New York things.
There's one of the things I remember is, I don't remember when this is, but there's like a Santa Claus parade and a bunch of drunk Santas do a bar crawl. So maybe avoid that one. But yeah.
My husband would find that entertaining.
I had my parents up in the city one year when that happened, and it gets pretty bad. And by like mid-afternoon, there's a bunch of Santa Clauses like thrown up in the street, and my folks are like, "What is happening?"
Hide the kids.